Have you ever found yourself asking any of the questions, what is occupational therapy? Or better yet, what is the difference between occupational therapy and physical therapy? I know if occupational therapy is the right career choice for me. If you found yourself asking any of those questions, then you've clicked on the right video. If you are a returning subscriber, hey girl, hey. And if you are new to my channel, my name is Amber Sharia, and on my channel, I talk about all things beauty, lifestyle, career, and everything in between. And on today's video, I wanted to take a look into the career of occupational therapy. For context, I am a 28-year-old occupational therapist, and I've been practicing for almost 4 years. I have experience in the acute care setting, the inpatient setting, and the skilled nursing setting where I currently work. And over on my TikTok, I've been getting a lot of questions, a lot of people wanting me to describe occupational therapy, talk about the different work settings, what's the benefit of occupational therapy, the difference between occupational therapy and physical therapy. And why not come over onto YouTube and make a video to show you guys an overview into the field of occupational therapy. For reference, while going throughout this video, I will be referring to occupational therapy as OT, physical therapy as PT, and activities of daily living as ADLs, and I'll get into that a little further and talk about what that means. What actually is occupational therapy? A lot of times when people hear the term occupational therapy, they tend to think that that means something with a person's occupation or their job, and that is actually very far off from what we as occupational therapists do. Now, there is such thing as vocational therapy, where OTs are able to help people regain their independence to be able to return to work. But overall, occupational therapy is a career field where we help patients return to their functional level of independence prior to an injury or illness. So how I like to explain it to family members and patients is that all I want you to do is to be as independent as possible, regardless of what medical condition, injury, or illness that you have. My job is to show you ways and methods to be as independent and safe as possible so that you're able to return home or to whatever environment is safest for you once you leave rehab or the hospital. There's so many different ways to describe what occupational therapists do because there's so much variety within the field, but it's super important that when you're explaining to family members, patients, and friends what an occupational therapist does, that you find your language and your verbiage to be able to explain it. So the way that I explain it may not make the most sense to you, and you don't have to explain it the same way, but it's always important to use layman terms. You want to use simple terms, a simple sentence, that people are able to understand if they have no medical background at all. And I found that this way, having a clear understanding of what occupational therapists do, it can help to build trust between your patients and family members. And that way you guys can also create clear, concise goals when you are in the rehab process. Probably the most asked question that I will get, and not just from people over on my TikTok, which I'll have my social media handles linked down below so you guys can follow me down there. But, family members ask me this a lot, and it is, what is the difference between OT and PT? And you'll be surprised, like throughout my workday, the amount of people, including nurses and staff, that will refer to myself and colleagues as PTs when in reality we are OTs, and I will correct them every time because get it right, boo, I worked for my credentials. But that's no shade to the PTs because their work is just as important as ours. But when I talk about the difference between OT and PT, I like to say how PT works a lot on your functioning strength. So they're going to work on your walking, managing stairs, building your lower body strength, balance. And then when I look at occupational therapy, we are working on the whole aspect of your life. So occupational therapy focuses a lot on ADLs, which we mentioned earlier, and those are your activities of daily living. And so what activities of daily living are, they are the things that you do on a daily basis, such as brushing your teeth, putting on your shirt, putting on your pants, going to the toilet, taking a shower, cooking a meal, driving, cooking, and any leisure activity that you may be involved in. So the overall aspect of our job is to be able to help you to do those things independently and safely. Now, occupational therapy and physical therapy do tend to overlap a lot. So I don't want you to think of it as just super subjective as OTs only do this and PTs only do this, because it can overlap. So in the skilled nursing setting, I will work a lot with ADLs, but I also work on walking and balance, because sometimes, you know, if we're working on being able to toilet yourself, you have to be able to walk to the toilet safely. So don't just think of it as, you know, OTs do one thing. OT is a broad concept, and you're able to work on multiple things, and it is not just limited to occupational therapy. So there you have it. Occupational therapy is an incredible field that blends creativity, science, and heart to make a difference in people's lives every single day. I hope this video was able to give you some clarity or insight. If you had questions about the career field and occupational therapy, please don't hesitate to message me on any of my social media if you have questions, or comment down below if there's other occupational therapy related videos that you would like me to make. Don't forget to like, comment, subscribe, and share this video with someone who you know might be interested in occupational therapy, physical therapy, or they want to take a look into different healthcare options that they may have. Then I will see you guys in the next video. Bye, babe.